Tonight, we discuss with pediatrician Dr. Victor Rosado the merits of getting vaccinated early.
Given the 90-degree weather we've been experiencing the past few months, colds and flus are perhaps the furthest from your mind. While Belize does not have an official flu season, the end of September and early October is usually the time most doctors start to see more patients with the flu. This is why getting a flu vaccine is best before the rains start.
Well, I think that more people are open to receiving the flu vaccine. 6 years ago when we had this discussion, people were like, why are you talking about flu seasons? We don't have flu seasons in Belize. We definitely have a flu season. It's not well documented. Fortunately, we don't have that readily available health statistics to tell us when we have a flu season for the last year. But we know from empirical data and from our patients visiting our clinics that usually late September, early October, we may not be able to define it as flu. We see an increase in respiratory tract illnesses.
The flu vaccine is available for free at public healthcare facilities countrywide and at a small cost at private institutions. While people have become more open to getting the shot, there still is a need to urge people to get vaccinated early.
You want to get it before you start feeling ill. That is, I think, one of the main points we want to drive home. When you start having a sore throat and getting a headache is not the time to get a flu vaccine. I think it's a little bit too late when you start getting ill. The best time is ideally early in the season, which is again late September, early October, because the vaccine works best 2 weeks after receiving it. So your body needs about 2 weeks for the process of antigen and antibody to work.
Flu vaccines are seasonal and are created for each upcoming season. So the current vaccine for the 2015-2016 season will be available in Belize in the next few weeks. One common misconception is that the vaccine gives you a flu, which Dr. Rosado says is just not so.
We don't believe you get flu from the flu vaccine. You might get a sore arm, you might get a headache for the first 24 hours, but it's scientifically unlikely that you will get actual flu from a vaccine because it's not a live, real virus that you're getting. Again, because people wait too late to get the vaccine, that sometimes they're already inoculated with the virus, they get a flu vaccine, and then a week later they come down with the worst flu ever. And so obviously they blame the vaccine. But we believe that it's because they got it too late. They were already inoculated with the virus. Some people have a fear of things that like mercury in the vaccine. Some people jump on the bandwagon of the anti-vaxxers and don't believe in vaccines. And so I think it is our responsibility as a responsible medical institution to try and weigh through all that information and advise people that a flu vaccine is safe.
Young children, elderly persons, and those with chronic conditions can benefit the most from getting a flu shot, but it is available for all other ages.
While it is commonplace, there is a cost, and it has to do with the amount of viral propagation that's in the community when nobody gets vaccinated. So if you have certain settings like, let's say, a school, or when you talk about costs, a work setting, for example. So it's in the interest of probably the employer to have 95% of their employees vaccinated, and therefore sick days will be minimized for that year.